Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. I'm very excited to introduce our guest today as we speak about IBS. Dr. Nitesh Vachhani is a board-certified gastroenterologist and board-certified internist who has been practicing in the Richmond, Rosenberg, and Sugar Land area since 2009. Dr. Prashani treats all general gastrointestinal and liver diseases, but his special interests are inflammatory bowel disease and liver disease. He is also experienced in endoscopic procedures, including colonoscopies and colon cancer screening. Thank you for joining us today, Dr. Prashani.
Well, thanks for having me, Donna. I appreciate it. And today we're going to be talking about a very important topic that is very prevalent amongst our community, irritable bowel syndrome. So I appreciate you as well as Oak Bend having me on this podcast today.
Great, because I think this is something everybody's kind of embarrassed about or doesn't want to talk about or thinks it can go away. So what exactly is IBS?
So IBS stands for irritable bowel syndrome. And I think you very astutely pointed out that it's something that a lot of people don't want to talk about. I mean, who really wants to talk about constipation and diarrhea and the way your bowel looks and how often you're going to the bathroom? I mean, these aren't topics that are easily broached by patients to physicians. Unfortunately, most people out there, occasionally do have changes in their bowels, whether it be from a pathologic reason or from a quote unquote nervous stomach, which I think we've all kind of experienced that at one time or another. IBS, however, is actually a disease process. Like I mentioned, we've all had an upset stomach once in a while, or we get anxiety and we got to go to the bathroom. But IBS is more of a chronic disease that has to occur over a period of time. And strictly speaking, the definition of irritable bowel syndrome is abdominal pain associated with either a change in the frequency of your stool or change in the appearance of your stool. So that's the strict criteria of what IBS is. So you have to have both, some type of abdominal distress as well as some change in the way your stool appears or how frequent it is. Like I mentioned, these aren't broached by the patient all the time. And so it's something as physicians, we sometimes have to bring this out from patients with direct lines of questioning. So it's something we see very commonly in our office, and we'll talk a little bit more about it here on this podcast.
Okay, so evidently irritable bowel syndrome is more common than we think.
Absolutely. Most studies say that the prevalence of irritable bowel syndrome is about 12% in our community. That means 1 out of 10 people have not only the strict definition, but this is, like I said, a chronic problem. That's quite a lot compared to some of the other GI diseases that we deal with, 1 in 10. Usually, and it's more often in females by a 2-to-1 ratio than males, and 25% more likely to occur in people under the age of 50. So we're talking about a younger patient population compared to some of the more chronic GI diseases such as cancer and gastroesophageal reflux disease. So younger patients, more likely to be female. But when we talk about prevalence, 1 in 10. So, I mean, it could be male, female, white, African-American, Indian. I mean, there's no boundaries. There's no specific types of people that this affects more. It's pretty widespread.
So what are some of the symptoms one might pick up on to let them know it's time to go to the doctor?
Well, I think, obviously we have to differentiate IBS from other disease processes. So of course, if there's a concern in terms of, a sudden change in your bowel habits or blood in your stools or weight loss that's unexpected, you certainly have to go to your doctor for those. However, in somebody with a known history of irritable bowel syndrome, I think it's important that you seek medical attention when it starts affecting your quality of life. I mean, for me, I see a lot of patients who tell me that, they don't go to their kids' soccer games or tennis matches because they don't know where the nearest bathroom is, and they have no idea when they're going to have to get up and go to the bathroom, urgently. So what's their solution to that? They just don't even go if they don't know where the bathroom is. So they're missing out on all these social aspects of friends and family lives. And when it starts affecting quality of life such as that, I think it's important to actually talk to your physician about it, because fortunately we do have some good treatments for irritable bowel syndrome, both emotional support, but also pharmacologic treatments that have now been made available, over the last 10 years or so.
So how is it diagnosed? Is there like a test you can do, or is it by exam, or?
Great question. So it's a clinical diagnosis. Back in the day when IBS was first introduced 15, 20 years, 25 years ago, you're right. We used to do everything. We used to do the full gamut of blood tests. You did the colonoscopy to rule out anything in the colon. You would order a CAT scan. It was kind of a diagnosis of exclusion. However, the paradigm has changed over the years. And instead of doing the $1 million workup, we now diagnose it clinically. I mean, if you see a young female who's got 3 kids who are attending, all these events, and they're running around and they have the classic symptoms of IBS without any of the red flags that we talked about earlier, I think you can make the diagnosis clinically by just talking to the patient, examining them, and really that's about it. You don't have to do a colonoscopy on everybody who comes in with a change in bowel habits. Of course, there are exceptions, and there are case-by-case basis, but generally speaking, it's a clinical diagnosis.
Can IBS be life-threatening?
IBS by itself cannot be life-threatening. It's not a life-threatening disease. But let me tell you, Donna, IBS leads to a lot of mental health. It's not only associated with depression and anxiety, but the symptoms itself lend itself to more depression, stress. And as we know, mental health is something that potentially, in its extreme forms can become life-threatening. And so I think indirectly, IBS not only affects quality of life, but there are long-term implications of having this for many, many years and having it untreated, and what it can do to you both emotionally and physically.
Well, there's a lot of doctors out there on the internet and self-proclaimed doctors, the kind you doctors love to deal with. Um, and there's advice out there, we'll take probiotics.
Probiotics.
Yeah. Does it help, or?
I get this question all the time from patients not only dealing with IBS, but there's, other disease processes, and whether probiotics help the gut. The environment in the GI tract and the gut is, it's an environment that there's a fine balance of good bacteria and bad bacteria that kind of live in this symbiotic relationship. And when there's an imbalance of these bacteria, sometimes the bad bacteria kind of override the good bacteria, and that's when you start having symptoms. So there is a train of thought that probiotics, which are good bacteria, repopulate these colonies of good bacteria and lead to a healthier environment and microbiome. So probiotics, I've found, do help in irritable bowel syndrome. There have been studies that show that it fights inflammation, it slows the growth of the harmful bacteria, it boosts your immune system, and it can also decrease gas production. So, there's millions of probiotics out there. That there is a marketing aspect of it. But generally speaking, they're all very similar. There's 2 bacteria, lactobacillus and bifidobacter, which are usually the ones that you want to see when you read the labels of the bacteria that you want to introduce into the gut. They're the good bacteria per se. So I think by and large, they're all very similar. And I highly recommend, once you've been diagnosed with IBS and you've ruled out all those other disease processes, that it certainly doesn't hurt. There's no side effects, and they only help. And, you can find them pretty readily available at your local pharmacy and Walmart and Target. And I think it's worthwhile using. I use them all the time in my practice. Absolutely.
And what about diet? Is there a certain diet that helps this? I know with gastro health, in itself? Is there a certain diet that we should be eating to help combat some of this?
So with irritable bowel syndrome, it varies. Everybody's different. Everybody's got their own exacerbators. But by and large, if we just take generalizations, dairy is a big one. Okay. So dairy and lactose does cause more bloating and gas and loose stools. So when I talk about diet to my patients, the first thing I do is tell them, hey, why don't we lay off the dairy for 1 week? And when I say lay off the dairy, I mean not just milk, but ice cream and cheese and yogurt and sour cream and the cream in your coffee. I mean, if we're going to do it, let's do it strictly speaking, everything, and see if that makes a difference. Another one is gluten. It's another one, and I'm sure the gluten-free diets, I'm sure everybody's read about, but it does make a difference. I mean, avoiding gluten, even if you don't have the celiac disease, which is the gluten allergy per se, but gluten intolerances are very common in irritable bowel syndrome. And trying 1 week of gluten-free diet and seeing if that helps, in a lot of my patients, diet modification sometimes is easier than medically treating IBS. So I always give these suggestions to patients. It's easy to stop lactose for a week. It's easy to stop gluten for a week and see if these make differences. But by and large, it does vary. And I tell my patients to make food diaries. After I see them for the first time, I tell them, hey, 1 week before you see me next time, I want you to make a diary of everything you eat and tell me when you develop your symptoms and bring it to me. And then I kind of look through their little food diary over a week and see if I can associate what particular foods may be exacerbating some of their IBS symptoms. Like I said, no two people are the same. And sometimes I've seen people who sucrose and fructose and chewing saccharin and gum. It's been all sorts of things that I've seen in IBS. So it is something important to talk about and something I do discuss extensively with patients.
Okay, so now you have IBS. How is that different from IBD?
Sure. So, obviously the initials are very similar, and that's about the only similarity between those two, but it does confuse a lot of people just based on the mnemonic. So IBS is what we're talking about today, irritable bowel syndrome. It's a fairly benign entity, but one that obviously causes a lot of discomfort and quality of life issues. IBD is inflammatory bowel disease. There's two diseases within IBD, Crohn's disease and ulcerative colitis. These are actually pathologic disease processes. They're inflammatory conditions that actually cause ulcerations in your GI system. They cause bleeding, weight loss. So these are, you definitely want to differentiate these two because the treatment for irritable bowel syndrome and inflammatory bowel disease are completely different. You'd want to give anti-inflammatories such as steroids for IBD. So as a gastroenterologist, we do want to differentiate these two, and getting a good history can make you rule out IBD as one of the differential diagnoses.
So I think I brought that up because the symptoms are similar, but the diagnosis, but it's two different diseases. So with that, at what point should they be seeing the physician? Because I don't want people to assume one or the other. They really need to find out what they're dealing with.
Absolutely. So there's red flags that if I hear or if a patient sees or hears, you got to go see a doctor right away. So if you start noticing blood in your stools, for example, you go to see your doctor the next day. If you're starting to lose weight unintentionally, if your bowel habits change all of a sudden, say you're going, once a day for 30 years and all of a sudden you can't go at all, that's a red flag. See your physician immediately. So these are signs that there's something more sinister going on in your body and you need to get this checked out ASAP. However, as far as IBS is concerned, to me, if it starts affecting if you start making decisions throughout your day that are based on your IBS, you need to go see a doctor. I mean, if you, like I said earlier, if you can't go to restaurants with friends because, well, you don't want to have to get up 3 times during the meal, if you're missing your kids' games, if you're not able to travel on a plane for more than a couple, I mean, if it's starting to affect your quality of life, I think it's time to see a physician. I mean, yes, physicians do treat life-threatening illnesses, but we also treat non-life-threatening illnesses that improve your quality of life. So I think seeing a physician for IBS, and I mean, I'm just thinking back to my clinic today, I would say 10 to 15 to 20% of my practice is seeing irritable bowel syndrome patients. So it's definitely something we see quite often. These patients have come to see us because they're not getting better, and it's affecting their quality of life. So I think once it starts doing that, it's time to see either your primary care physician or come see a gastroenterologist.
So what we'll do is post Dr. Prashani's information so you can come see him. He's one of the best gastroenterologists that I've ever had the pleasure to deal with. So I encourage people to do this. And I also encourage people to have their colonoscopies, because that also helps you introduce yourself to the gastroenterologist and keep good gut health. Dr. Prashani, is there anything else you want to add?
No, I mean, I think that was a good summary of what IBS is. The only other thing I want to add, and it's kind of unrelated, is there's been recent changes in March, which just a few weeks ago was Colon Cancer Screening Awareness Month. Colon cancer is the second deadliest cancer in the US, and recommendations have now changed. You always used to be 50 years and up, but now it's actually 45 and up. So younger and younger people are getting colon cancer. One thing I can say out there is get screened. Colonoscopy is not a procedure that we all envy to get, but it's a very small price to pay given what the repercussions could be for not getting a colonoscopy. So listen to your body, listen to your gut health, and get your colonoscopies at age 45.
And Dr. Vachhani, one more thing, because I want to make sure people understand this. There is also a Cologuard test out there, and there is a difference in getting a colonoscopy and taking a Cologuard test. And people feel safe. I've had a Cologuard test. Do you want to explain the difference in those two tests?
So colonoscopy is direct visualization of the entire colon, and at the same time, therapy, meaning you're not only seeing, but you're also removing potential polyps that you may see, and therefore, decreasing the risk of colon cancer. Cologuard, on the other hand, it's a pretty insensitive, it's not a very sensitive test. Sure, it does pick up some DNA changes from colon polyps on a stool sample. For people who are too old or too sick to have colonoscopies, people with really bad lungs per se, or had heart issues, it's a second viable option, but by no means is it as sensitive and as therapeutic as colonoscopy. So as a gastroenterologist, frankly, I hardly ever order Cologuards, to be honest. I'd rather you order a Cologuard than not do anything. And that's kind of where Cologuard's place is in the medical community. But if you're 45, you need to get a colonoscopy. And that's kind of where we stand on that.
And I want to make sure everybody understands that, because early detection of colon cancer can easily be treated versus waiting. Is that a correct statement, Dr. Prashani?
Well, colonoscopies are not for colon cancer detection. We actually want to detect these precancerous polyps and remove them before they can even become cancer. So the reason we do this is to find colon cancer at its infantile stages as polyps, as opposed to finding cancer. We don't want to find cancer at all.
Right. So everybody get your colonoscopy. If you're having any kind of gastro problems, go see Dr. Vachhani, or if you want to, another gastrologist, and get taken care of, because you want to have the best life you can have. Dr. Prashani, thank you for joining us again today. You always enlighten us with great education. And a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. We ask that you join us this week and make time to spend time with your family this weekend. Have a great evening.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.